Hi, it's Tanya from Nurture Wellness. Welcome to my 21 Days of Self-Care video series. Today's self-care is a lesson about and some self-care around repetitive strain injuries. Repetitive strain injury is injury or damage to muscles, tendons, and nerves in relation to overuse of muscles, and often in a repetitive motion. Common types of repetitive strain injury include tendinitis, bursitis, and nerve compressions, such as carpal tunnel syndrome and sciatica or piriformis syndrome. A tendon is the fibrous portion of a muscle that attaches to bone. The most common RSI, repetitive strain injury, that I treat in my practice is tendinitis, or inflammation of a tendon. Inflammation of a tendon leads to deep, achy pain that is worsened upon weight bearing or lifting anything with weight to it. And that could include just lifting the weight of your own arm or wherever the tendinitis may be. The trick to treating repetitive strain injury is that often the best medicine is rest from the activity that's causing the repetitive motion. But if that activity is your job or a competitive sport, you can't take a complete break from it. So often the focus is on modification and gaining proper alignment around the joints and tissues in that area. It's also extremely helpful to seek out healing modalities such as massage therapy and acupuncture, physiotherapy, to help to realign that tissue, to help learn exercises that can help stretch or strengthen the area, and also what to do and not to do, what might make that feel worse, and also learn what might make it feel better. It's important to have a proper assessment from one of these healthcare professionals to ensure that you're getting to the root cause of the tendon inflammation and pain. Tendinitis can occur in any muscle, but today we're going to focus on a very common spot in our elbow and forearm. We often hear about people having tennis elbow or golfer's elbow. The tendinitis in either side of our forearm are associated with each of those sports, but can often be caused by computer and device use in a repetitive way for several hours a day. I'm going to demonstrate some very easy stretches that you can incorporate into each day that are extremely preventative for forming tendinitis, a tennis elbow or a golfer's elbow in the forearms. And also these stretches can be used if that's something you have struggled with or are working on healing from. These stretches are great to do each day in a pain-free range. So we can start by holding one arm in front of us with our palm facing down towards the floor. And we're going to keep our neck fairly relaxed. You can do this sitting or standing. And then we're going to take our other hand and just pull that hand down towards ourselves so that we're taking the palm of our hand towards ourselves. So that's stretching the extensor tendon, and that's the tendon that's responsible for tennis elbow. I want you to do 10 seconds in a stretch position, and then 1 second just bringing that up into the opposite direction, and repeat that 10 times. Once we've repeated that 10 times, we're going to flip our hand over with our palm facing the ceiling and do the opposite stretch for the tendon that's responsible for golfer's elbow, our flexor tendon. So we're going to bring our palm out in front of us, so the back of our hand towards our body. Using our other hand, same principles, we're going to hold for 10 seconds and then bring up into the opposite position for 1 second and then hold for 10 seconds. And we're going to repeat that series 10 times. We're going to do this for each surface, so the flexor and extensor surface. We're going to do it to both arms. This stretching series can be an excellent tool in preventing tendinitis at the elbow, and I recommend this for anybody who works at a keyboard or computer for long periods of time. Give it a try and let me know how it goes.